Hi guys, Dr. Lili here with my pocket pediatrician. This week I had a patient tell me we rushed him straight to the ER because his fever was 102, and we know that's when the brain damage starts. I also had a patient come by ambulance because their child had a fever of 104, and I had at least a dozen patients tell me that their child was there with a fever of 99. And I realized I've been doing this channel for 11 months and I haven't done a video on fever yet, which is one of the most confusing topics for parents. So if you have any burning questions about fever in your child, we're about to jump right into this hot topic in pediatrics.
When the doctor says my child has a condition, I'll learn more at my pocket pediatrician.
So let's just start with the basics. I saw an article a few months ago that said something like, you're a good mom, you know when your child's hungry, you know anything above 98.6 means your child has a fever, and you know how to kiss all the boo-boos. It was a sweet article kind of encouraging mothers, but the problem I had with it is that anything above 98.6 is not a fever. Normal body temperatures usually fall somewhere between 97 and 100.4. 100.5 or 38 degrees Celsius would be what we would consider a fever. I once heard a frustrated pediatrician try to explain fever like height. Just because 5'9" might be the average height of a male, it doesn't mean that something's wrong if you're 5'2" or 6 feet tall or 6'3". Just because 5'9" is the average height doesn't mean everybody has to be 5'9" all the time. It's a range, just like temperature. Normal temperatures fall across the spectrum, but somehow we've become obsessed with the number 98.6, and everyone thinks if their temperature is anything other than that, there's something wrong. Okay, so let's talk about what fever actually does. There's a small center in the brain called the hypothalamus, which is in charge of regulating body temperature. When the body is fighting an infection, the hypothalamus will raise the body temperature to help the body fight off the germs, whether it's viruses, bacteria, or something else. In adults, the hypothalamus has a slightly tighter control, so adults don't tend to jump up with high fevers as quickly as young children do. However, in children, the temperatures are not nearly as tightly regulated, and so fevers can jump up and down fairly quickly, which would make an adult very uncomfortable. These big swings in body temperatures can also be pretty scary for parents. I do get a lot of questions about what temperature is actually the dangerous temperature for your child to reach. One popular medical website said that high fevers can cause seizures, which is kind of true, but in my video about febrile seizures coming out next week, I kind of explain how it's not usually the height of the fever, but how quickly the body jumps in temperature that causes a febrile seizure. Now, when we're thinking about heat stroke and heat exhaustion, that's something different. When you're talking about heat strokes and heat exhaustion, the body temperature can climb dangerously high, and at that point, the hypothalamus loses its ability to regulate the body temperature. That can be dangerous, and if that's the case, we do initiate active and passive cooling measures. However, most kids with a febrile illness will maintain control of their body temperature, and even if their temperature goes up to 104, 105, sometimes even 106, they're still in control of their body temperature, and nothing dangerous is happening. Now, it is important for you to actually take your temperature and know if your child had a fever of 100.5 or greater. I have tons of moms, dads, grandmas come in and tell me their child's been burning up, and when I ask how they took their temperature, they said, oh, I just put my wrist on her head or my lips. And when we take the temperature, it's only 99 and they hadn't given any medications. A lot of studies have shown that it's just not possible to accurately determine the child's temperature by your own wrist or hand or lips or anything else. I have another video coming out on how to take your child's temperature, so watch out for that one as well. Now, when your child has a fever, he or she is definitely going to feel uncomfortable. Children might complain about headaches or body aches. They're definitely not going to want to eat or drink anything. Their hearts beat faster and they tend to breathe faster and harder when they have a fever. A younger child will likely be fussy, and an older child might be a little listless and just kind of lying around and not wanting to interact as much. So what do you do when your child has a fever? Well, there are two basic categories of medications you can give your child: acetaminophen and ibuprofen. Acetaminophen and ibuprofen are both fever reducers. Both work slightly differently to reduce the body temperature, and I have another video on how to give your children these medications safely and effectively. We'll talk about timing, doses, all that kind of stuff. There is some debate about even treating a fever. In some places, they feel like the fever is the body's natural response to illness and that it's not doing any harm, it's actually helping you fight your infection, and so you shouldn't treat it. Other people feel like, well, if your child's uncomfortable, you should treat it so that they can get better faster. So here's my take on it. If my child is miserable, awake, not feeling good, and has a fever, I'm going to give him something to treat his fever because I want him to drink, keep himself hydrated, and get better on the road to recovery. If my child's sleeping, it's the middle of the night and I go in to check on him and he feels a little warm, I'm not necessarily going to wake him up, check his temperature, give him medicine if he's already asleep and comfortable. If you feel like your child's uncomfortable, go ahead and treat them. You want to make sure your child is feeling well enough to drink liquids, which also helps the healing process. I also see a lot of kids coming in for fever who are bundled up in jackets and down blankets and all kinds of stuff. And that's really the opposite of what you want to do. These poor little kids are sweaty and red-faced with their puffy jackets all around them, and they're miserable. When my kids have a fever, I usually get some thin cotton pajamas, get them dressed in those, and let them just kind of lay down and rest. And that way, the fabric's breathable, their body can breathe, but they still have the comfort of having clothes on. If you feel like you've given a medication and it's not working, you can also try a lukewarm bath. Not a cold bath, but if you get a nice lukewarm temperature and have your child sit in there for a little bit, that may also help bring the body temperature down in a comfortable way. Sometimes I know a patient has a fever before I ever walk in the room, and that's because I smell the onions. There's a pretty popular belief that if you put onions in your socks, it will take away a fever. I often have a lot of people come to the ER because they're confused about why the onions didn't work. And I'll say, well, did you try acetaminophen or ibuprofen? And they say, no, but I did all the onions and I gave them some garlic and some honey and the fever's still high, so I just don't know what to do. Basically, no studies have really been proven to show that onions can actually do anything to reduce a fever. There's probably not any harm in it other than the smells, but if your child has a fever, I would recommend using one of the fever reducers. Now, the other question I get all the time is, when should you bring a child with a fever to the doctor? If you have a baby who's 3 months or younger and they get any kind of fever, 100.4 or greater, they need an immediate medical evaluation. Fevers can indicate serious illnesses in young babies, including meningitis, sepsis, and other concerns. So babies under 3 months need an immediate workup by a physician. Babies in the 3 to 6 month range who have received their 2 and possibly their 4 month vaccines should also be seen more urgently for fever because they may need some evaluation as well. You could call your pediatrician and set up an appointment in the next day or so. Now, if we want to talk about older children who are fully vaccinated, fevers are still very common. It can mean a simple cold or viral illness. They can also indicate ear infections, strep throat, influenza, pneumonia, urinary tract infections, appendicitis, gastroenteritis, which is vomiting and diarrhea, or other types of infections. Some of these conditions require treatment and some of them don't. The flu may give you several days of high fever, and I hope we're hitting the peak of flu season now and it's not going to continue to keep rising, but definitely flu would be something that gives you high fever for several days. A simple respiratory infection usually only gives you a day or two of fever. You do want to bring your child in if the fever is not responding to the appropriate doses of the fever reducer medications, or if your child is showing any signs of difficulty breathing, decreased responsiveness, lethargy, changes in consciousness, dehydration, or other concerns. I see people who are upset all the time and venting online because the doctor said it's just a virus, and they wasted their time finding out their child doesn't need any medication. What your doctor did, though, was use his or her years of experience and expertise to determine that your child doesn't have an ear infection, doesn't show signs of strep throat, doesn't look like they have any signs of pneumonia, has no neck stiffness or signs of meningitis, doesn't need to be tested for appendicitis or urinary tract infection. Sometimes we will do certain tests to look for sources of fever, and sometimes our physical exam can tell us that those tests aren't necessary. Now, the magic number in terms of length of time, about when we start looking for other sources of fever, is 5 days of fever. So for a healthy child who has 5 days of fever every day higher than 100.5, we really want to make sure we're able to identify the source or start looking for other sources of fever. Most fevers with illnesses will resolve within 5 days. So if it's going longer than 5 days, we need to find out if something else has developed, like another bacterial infection on top of whatever viral infection started, or if there's anything else going on, like an inflammatory process. So if things are heating up in your home and your little one has a fever, I want to say, one, I'm sorry. I know it's scary. Even with all my years of training and experience, when one of my children is snuggled up in my face with their hot breath and their hot skin burning up on my face, I can't help but think about all the bad things I've seen and strange cases and outliers, and I start to worry, and I understand why parents worry when their child has a fever. It is scary, and if you start going on Dr. Google, you're going to find some pretty scary articles as well. But the truth is, kids get fevers. It's just part of life. They just don't regulate their body temperatures the way that we do, and it can be perfectly normal for them to bounce up and down in their temperature. So the takeaways I want you to have from this are the following. Number 1, fever is 100.5 or higher. 99.9 is still a normal body temperature. Just like 6'3" can still be a normal height for a man. Number 2, take your child's temperature with a thermometer if you suspect they have a fever. It's very helpful for us to know what the temperature actually is and the timing of it so that we can figure out what tests or evaluations need to be done. Number 3, newborns and young infants need emergent or urgent evaluations of fever. If your young baby has a fever, seek care or discuss with your pediatrician immediately. Number 4, if your child is showing any worrisome signs like signs of dehydration, difficulty breathing, the fever is not responsive, they're having changes in behavior, then seek medical care immediately. Number 5, we can't always tell you the exact source of the fever. Most of the time, it really is just a virus, but a good exam from your pediatrician can help narrow the source, determine if any antibiotics or further testing might be necessary. And finally, number 6, if your child is uncomfortable, please go ahead and treat the fever. A lot of times people won't give their child a fever medicine because they want to make sure we can actually see the fever ourselves to prove that the child had a fever. We will believe you if you take the temperature and tell us the number. We want you to get your child comfortable so they're drinking, feeling better, and are on the road to recovery. Make sure you subscribe so you can check out my videos on the best ways to measure body temperature and also how to give fever-reducing medicines. Also, my video on febrile seizures will be out next week, and I don't want you to miss out on that either. So I hope this has been helpful. If you have any burning questions, please post them in the comments below and I'll do my best to answer them, either in the comments or through another video. This is Dr. Lili with My Pocket Pediatrician. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.